This meeting is being recorded. I want to thank you for joining the Mhcc Learning Network event today. Our topic is assessing and vetting community resources. My name is Melanie Cavalier, and I am the Chief of Innovative Care Delivery at the Maryland Healthcare Commission, or MHCC. Today, you will hear from two advanced care delivery organizations about how they assess and vet community partners. But first, I want to give you some background about MHCC and our advanced care delivery initiatives. Next slide, please. MHCC is an independent state regulatory agency. We support advanced care delivery and practice transformation. Our aim is to shift the focus from quantity of care delivered to improved health outcomes and coordinated care delivery. Our activities are aimed at implementing strategies focused on patient needs and assessing barriers to transformation and propose those solutions. We also educate providers and consumers on value and best practices. Next slide, please. So I'm going to tell you about how some of the initiatives that we do support our learning network. The first is a Health Equity Practice Roundtable. And we convened this roundtable in March with representatives from advanced care delivery practices to identify challenges and opportunities for practices seeking to address key health equity concerns in their community. And this roundtable will help with the development of practice resources, such as one of these learning network events. Our next meeting is on June 1st, and more information and prior meeting materials are available at the link on this slide. Next slide, please. We also convened a patient-reported outcome measures roundtable in April with payer, consumer, and advanced care delivery representatives, again, to identify challenges and opportunities for practices seeking to implement PRO measures. The discussions will inform the development of practice resources, and the next meeting is on June 8th. The information and prior meeting materials are available at the link on this slide. Next slide, please. So the next initiative that I want to talk about is a grant that we have for advancing practice transformation in ambulatory practices. We released an announcement for grant applications in May of 2021 to identify a care transformation organization to engage eligible primary and specialty practices in a practice transformation program. The grant objectives include preparing practices to deliver efficient, high-quality care while improving health outcomes, laying the foundation for practices to provide team-based, patient-centered care and efficient use of health information technology, and supporting the total cost of care goals by readying practices to participate in value-based care models. Next slide, please. So in June of 2021, Mhcc CTO was competitively selected to complete the transformation activities. A crucial role of Mhcc CTO is providing practice coaching on specific transformation topics and approaches, such as quality improvement and tools to help sequence and manage change essential to succeed in a VBC model. The program milestones include a readiness assessment, workflow redesign, and training. Next slide, please. So the MHCC convenes peer learning events such as this in collaboration with local and national healthcare leaders on topics such as telehealth, advanced care delivery, and practice transformation. More information on our learning network events is available on this slide. And the next event is scheduled from June 21st and will focus on community partnerships that support long-term care. Next slide, please. Some of our prior events include innovative models for managing patient populations, innovative team-based care, innovative value-based payment models, advancing practice transformation, and engaging patients and family councils during COVID-19. So at this time, I would like to turn the presentation over to our representatives from Carroll Hospital.
Thanks, Melanie. Hope everyone is doing okay today. So my name is Jordan Trumpauer, and I am a nurse ambulatory care management team leader for the Ambulatory Care Management Program department at Carroll Hospital. I've been a nurse since 2012. I started my career in bedside nursing with surgical oncology, and then I transitioned over to ambulatory care management in 2017, and I've been here ever since.
And good morning, everyone. My name is Cheryl Gosagio. I'm also from Carroll Hospital. I'm a clinical social worker here. I'm the manager of community care services. So my background as a social worker, I started out in public child welfare and have been working in the medical field with care management since 2013. So I currently manage our ambulatory care management team as well as our peer recovery team at Carroll Hospital, and we are located in Carroll County.
Next slide. So our presentation today is to help you connect with community resources. So our learning objectives identify statewide resources available to all counties of Maryland, know how to identify a community resource as a good referral source, and then to know how to identify that the community resource is right for your patient. So in this presentation, we'll provide you with some examples of resources that we utilize for our patients, and then how to initiate that process. Next slide. So this slide has 2-on-1, which some of you might be familiar with. It's a resource that is available statewide, and it's, I feel like, more useful in highly populated areas. They are working to develop their system to bridge gaps and strengthen that handoff. And they're looking for ways to make their website, more beneficial and user-friendly. They are working with, it was Aunt Bertha, it's now Finding Help. They're going to be working together to create a more cohesive resource database to, sync together their resources. So this is something that is available for either care coordinators or patients to be able to utilize. Next slide. Another resource that care coordinators can use is the CRISP e-referral process. So our team hasn't utilized this much, so I can't really speak on how effective it is. But it is a way that you can refer patients. It's a closed loop, referral. And we just created a screenshot here. You can see different things that you can refer to. So that's another resource that's available. Next slide. So every community has resources specific to their particular population. And the most efficient and comprehensive approach is to start with those lead community agencies. So when you do this, you have those go-to people and you're tapping into their knowledge and their systems that are already in place. So you aren't reinventing that wheel. For our community, those key community service agencies are the Health Department, Bureau of Aging and Disabilities, and the Department of Social Services. But those are agencies that are present throughout Maryland and available to all communities. So with the Health Department, we listed here some of the things that we utilize them the most for. So behavioral health, which I'm sure is a priority for everybody right now. It's definitely one of our top needs in Carroll County. So especially with Medicare patients. So the Health Department is a place that you can access. It's a behavioral health resource and services directory. They can help with mental health first aid, suicide prevention. They also have their own peers there. So Medicare, Medicaid enrollment, pretty self-explanatory. Maternal child health, that's for, pregnant women, infants and children, who are at high risk of, needing assistance and support. And then WIC with, women who are pregnant and breastfeeding. Environmental health just focuses on the safe food and water in the community, safe living environments. Reproductive health, they help provide, exams, STD testing, birth control. And in addition to that reproductive health aspect, they can help with breast and cervical cancer screenings and colorectal screenings as well for patients who need assistance with that. Smoking cessation is always important. They have free programs and counseling through their cigarette restitution fund. And then medical assistance transportation, that is also one of our top priorities, our high needs in our community. So we have very limited transportation options around here. So that is a resource that is available to people with medical assistance, but there are, very strict eligibility requirements for that. Next slide. So one of the other agencies we utilize a lot is the Bureau of Aging and Disabilities. So this is a great resource, and it has, a lot of information there. So, guardianship, if you're working with somebody who's unable to make those decisions for themselves or handle their finances, you can reach out to Bureau of Aging to help, get that process started. Maryland Access Point, I know this is something that is available in all counties. So it's that single point of entry to receive that information on services that are available and assistance in obtaining benefit programs. So they can, make those referrals as well. So that's like a good place to start. The Ombudsman Program is an advocacy program, for people who are in nursing homes and assisted livings. They can help investigate complaints and resolve any kind of problems. State Health Insurance Assistance Program, also known as SHIP. So they help with Medicare beneficiaries understand their insurance a little bit better and their benefits. There are also a lot of community-based programs. So it helps to allow people to age in place. So people who are at risk of, nursing home placement, they can get connected to these programs to help them to age in place and stay in the community. So sometimes there's, case managers available to help them, and just gets them connected to more resources. There are senior centers in every community. And then for us specifically, we do have a liaison within our team. She's a social worker who's a community care navigator, and she has specialized training in navigating the healthcare system, but also especially all of those Carroll County Bureau of Aging resources for high-risk individuals in the community. So she is able to kind of bridge that gap for us. Next slide. The other agency we connect with is Department of Social Services. So, they have things such as child welfare. So, CPS or adoption foster cases, adult services. So that, includes adult protective services for vulnerable adults, which we definitely utilize a lot. But then there are also different programs that adults can be eligible for, like social services to adults or in-home aid services. So just different resources that allow patients, again, to stay in the community and get connected to the appropriate resources. Sometimes that can help with like in-home care as well. Financial assistance. So SNAP, is the Supplemental Nutrition Assistance Program. So food stamps, again, stuff with Medicare, Medicaid, and cash assistance for people, just needing financial assistance at home, like with utilities, and then child support as well. Next slide. So here's kind of where we get started on identifying those specific resources. So we included an image of a pyramid because, you start out at the bottom and make your way up to the top, and the bottom is your foundation. So, you want to make those connections with those local agencies and what services they offer. And by finding those key contact people that are willing to collaborate with you, it establishes that foundation for all the work that follows. So you start with those connections, then determine if the community resource is good, and then you match the resource to the patient. Next slide. So the middle block of that pyramid is, how do you know if a resource is a good referral source? So, you can start by reaching out to colleagues at those established organizations for insight. They're already knowledgeable on their systems that are already in place, and they're well positioned to provide those services to the community because that's what they're there for. So, they know what's required. They have the appropriate licensing. But you also want to pay attention to the agency's reputation and personal patient experiences. You know, if you refer a patient to a resource and you're consistently getting negative feedback from, you know, patients, then maybe you need to reevaluate that resource. You know, going back to, you know, what I had said at the beginning, you know, it's just important to make those connections with those agencies. So you want to reach out directly to the community resource to gather details about the services that are offered. So a lot of times agencies can share all the wonderful services that they provide, but there's a caveat to things. So like, you know, they might only accept Medicaid primary, not secondary. So finding out those details before is very helpful in connecting your patients. You know, there's also sometimes a limitation on how many referrals an agency can take, or there's a wait list. So knowing the volume of the accepted referrals and the potential wait list is critical, because otherwise it just becomes very frustrating for everybody involved. And then, you know, for resources of high interest, you know, it's encouraged to set up information sharing, such as the conference call or a site visit, to learn more about their services and begin that relationship with them.
And this is really where practices and groups can really tailor their approach for their particular community and patients' needs. So if you're in a practice and you're just seeing over and over the same kind of needs that patients are having in a specific resource area, that may be where you want to focus on really diving in a little bit deeper into the resources that are available in the community and having even closer relationships with those community service providers. It's just impossible to know everything about every resource. Organizations and services, they're constantly changing. It can be really hard to keep up with things. But through the work of the practice and assessments that are being done and feedback from patients, a lot of times you'll see trends of we have a lot of need in transportation, we have a lot of mental health needs, we have a lot of substance use needs, whatever that may be, that may be really where you want to do that information sharing, those information sharing visits with conference calls and site visits with those community organizations. Oftentimes communities too, I know in Carroll County, we have a community needs assessment that happens on a regular sort of multi-year pattern. And that's something that is community-wide, and that can really help guide as well for the community at large where some of those high need areas are. So there's a lot that is already happening out there that if you can start by getting tapped into what's already happening and then tailor what your office and your patient needs, that can be really helpful as well.
Next slide. So the next part of that pyramid, so how do you determine that the community resource is right for your patient? So not every resource will meet the needs of your patient. You know, healthcare is always individualized to the patient. So, you know, there are things you need to consider. So does that resource meet the patient's needs? You know, there's turnaround time versus when the service is needed. So like I had mentioned, you know, places do have wait lists. So is that okay right now, or is the patient going to need something that's more readily available? You know, also considering the level intensity of care and services that a patient needs. So, you know, some people need a little bit more comprehensive case management with more frequent check-ins, and other people might need something like, you know, once a month. So there's also always that eligibility criteria, you know, age, disease type, income, county of residence, insurance type. So it's always important to know that information beforehand, you know, and that way you can refer them to the appropriate resource. What are the associated costs? You know, we work with a lot of low income individuals. So can the patient afford that resource? You know, there are sometimes associated costs with that. So our department, like we work with patients, we're a free service, but we do refer to agencies that there is a cost. So, you know, is that something your patient can afford and maintain? Does the patient perceive any kind of barriers to participation? So requirement to disclose financial information. You know, some people don't want to give their information out to an agency, which is perfectly fine. There are a lot of scams out there, so it is scary to give that information. And, patients just don't feel comfortable with it or even know or understand enough to be able to do that. Same with the complexity of the application process. Some people might need somebody to be able to walk them through that process. So does that agency have somebody who can do that? Somebody who understands the application and, what is needed for that service and help the patient get all the documents ready. And then a delayed response from the resource agency, does that agency respond in a timely manner? So that goes right back up to the top where, the turnaround time, it's important. And, is the community resource willing to collaborate with you? So along with that delayed response, this can be very challenging. You can refer a patient to a resource, but that's where the communication ends sometimes. So you might need to take that initiative to confirm that the patient has actually linked to that service and try to get updates regarding any barriers that are encountered in linking to those services or additional needs. So, that might be just confirming with the patient, but also potentially, talking to the agency to see, if they've been able to connect with the patient and identify anything else that they might need. So sometimes, with HIPAA and medical stuff, agencies can't disclose information to you without a release of information. So taking that initiative is key to being successful. Next slide. So here we have a little graphic about, patient engagement. So we can't forget about patient engagement. So this visual here is, people that are working together to keep a process going smoothly. And that's basically what it's about. It's a partnership, and patients do need to be engaged in order for things to be successful. If you've, vetted the appropriate community resource, you've connected the patient and identified any known barriers, then this is your opportunity to take a step back and realize that there's still some kind of barrier on the patient side if they're not being engaged. So, there's always a reason. So you just need to try to figure out what that barrier is. Next slide. So here we have our contact information on how to get in touch with us. Like Cheryl was saying, you're not going to know every resource in the community, and it's constantly changing. So this is just a way to establish a framework to know what resources are available in your community and where to start, because it can get very overwhelming. It's essential to continually engage your community partners, and just so you have that continued collaboration to meet the needs of your specific population. And that's everything. So we'll go ahead and turn it over to Jackie with Adventist Health.
Thank you, Jordan. Hello, everyone. My name is Jackie Cruz. I am a nurse. I work with Venice Healthcare, and specifically, I am the manager of outpatient care navigation, and I work primarily with the MD-PCP primary care programs. And so you're going to get a different perspective on the way. On this presentation, we work specifically with certain populations, and it's from a CTO standpoint. Next slide, please. And before I begin, SDOH have become are playing a large influence on all of our patients. SDOH play a major role in making sure that the individuals have good health outcomes. So in order to have a significant impact on the needs of the health of our patients, we need to address the needs outside of the clinical setting. So again, addressing the needs and any barriers that they may encounter. So the first thing we normally do, again, we're working with specific populations. We do a needs assessment in all our patients. So every patient enrolled in care navigation completes an SDOH assessment. And we're really evaluating for, everything. We're evaluating for food insecurity, housing needs, utility needs, financial strain, medications, transportation needs, social isolation is a really big one, especially since COVID, exposure to violence, and health literacy. Next question. Next slide. Yeah, so I just wanted to show you all a slide on how we use the database tool that we utilize. So we do our SUH assessments, and this can be done, you know, over the phone. Sometimes the nurses are at the practice, and so they're able to do this, you know, face-to-face with the patient. And we're able to see, based on the assessments that we do in a particular month, we're able to gather data about all the assessments that we took. So giving us that data, you know, most of our population you see here is females. The range that we're serving is our greatest ranges from 61 to 80. And for this particular month, the greatest need identified in our SUH assessments was transportation needs. So again, this is really good information for us as clinicians, as, you know, evaluating our patients' needs and seeing, you know, what is most common in our population. And I think this is so vital because it gives us ground to start working on. So what are the needs that we're seeing in our patients? What is it that we need to gather more in the community and, you know, build relationship with in order to address our patients' needs? Next slide. So resources. So we saw a little bit of Carroll County's team. Jordan, you know, gave an overview about the resources that we're utilizing. And again, as a CTO, we're also utilizing many of the resources that they shared with us. But what we have found very, very helpful within our team is that we keep an internal shared drive of the most used resources with best contact details. You know, building relationship with organizations, using multiple sites to find resources. I think that's so important because, you know, if you've been looking around, if you try 211 and then you do findhelp.org, which used to be on Bertha, you'll see like differences in the information that they provide. Some have more definite information about the people that they serve, the ages, the requirements that they have. And so mix matching and just utilizing various resources will really help you out in trying to see what other programs there are in your area. The department, so again, we are working, the majority of our patients are MD-PCP, so they're Medicare patients. So I always say one of the best tools to use is, you know, the Department of Aging and Disability. Many times we have many instances where we're sort of left at blank. You know, we have a new patient, a new case we've never experienced before, and we just need guidance as to what is there out there for these patients. And we call the Department of Aging, and you know, you'll speak to someone and you'll tell them, you know, exactly what the scenario you're looking at, and they'll be able to guide you, you know, as to what you should be looking. And so that has always been a very good resource for us. Calling, I don't know if you've ever called 211. They also have like the behavioral health crisis, in which you can connect patients to. And I would, it's so important to vet, you know, the different places like previously mentioned, you know, call these places, ask them questions about, you know, what populations they're serving. You know, don't be scared to ask questions. I think that's the way we learn, you know, what resources are in the community. We also bring in our team meets daily on huddles. And so, you know, when there is a specific need that we've identified, we connect to organizations, and then we bring these organizations to do a, you know, whether it's a small presentation, or it could be, you know, a 15-minute, 30-minute, where they just share resources. And that's really the best time to gather, you know, to make connections with those individuals. What is the best way for referral? You know, many organizations have different types of referrals. What would you prefer? You know, what's the easiest way for your internal team to send these referrals? What's the best contact? Who should I email? You know, and just having those in hand, that's like very beneficial for our team. And again, like I mentioned, keeping that internal drive that anytime, you know, the team is like, I need this, they know where to go to find these resources. One thing that we have definitely seen an increase, and I'm pretty sure all across the board, everyone can say this, is behavioral health. And unfortunately, the need is greater than what there's actually able to service. So within our internal team, we had to when our outpatient wellness clinics, they helped out and they were completely booked, and we needed to send patients into to seeing psychiatrists, to seeing therapists. And so what they did, we had someone assigned and, start calling every agency, what insurances they accept, are they taking new patients? And we're building that internal list within ourselves. So when we have a patient that needs to see a therapist, and as if you have called before, many places are not taking new patients. So just keeping those agencies that are accepting new patients, that's been very beneficial. And again, this has to be a work in progress, right? So it has to be, things change very rapidly. And so you have to be just knowing that, most likely the organizations, the clinics that you're partnering with may change. They like previously mentioned, they might stop taking patients. So it has to be something that needs to be updated very frequently, especially, during COVID and, post-COVID, we've definitely run into those type of scenarios. Next slide. And this is, again, we're blessed to be part of a big organization. So we have at Venice Healthcare, we have two of our hospitals. So we have practices we have in Montgomery County, Shady Grove Medical Center, and then we have also our White Oak Medical Center, and we have practices within all those close to those two hospitals. We do also have patients, we do have practices in PG County, and we have, encountered that these in PG County, it's much harder to find resources for patients. But I just really wanted to share, it's so important that within your internal organization, you're building relationship with knowing who is in your community and who you're able to serve. And these are, we have partnered with these different organizations, and just, making sure that we have a contact that we can reach out to them. I have Luz on one of my care navigators as well, that, she can share a little bit about, which organizations we're closely working with, and, what the process of that really is. Luz, do you have anything to add for this slide?
Yes, good afternoon. Yes, as Jackie was saying, we work with not only Montgomery County, but we work with PG County also. And those of you that have worked with PG County know that resources are more scarce there. So a few of the places, after doing an assessment with our patients, if they tell us that they are low on food, of course, our number one is Food and Friends. I used to use Senior Nutrition Program, but right now they're waiting on funding from the federal government. But they will refer you over to the Food and Friends in DC. And but I believe that Senior Nutrition Program will be up and running by June, and that services anybody over 60 that has any medical issues and they're homebound, and the food's delivered directly to them. I also work with a few pantries in PG County, a few faith-based, St. Michael's in Adelphi, and St. Mark's in Hyattsville. And we also have a 1-800 number I can call in PG County, and they'll give us the available places where they're giving out food that day. So the one bad thing about that is that somebody does have to go pick up the food. But so if a neighbor of a patient can go pick it up, they usually can get food once a month. And it's really nice canned goods and vegetables. And so after the assessment, if they tell us the next issue they're having is transportation, of course, our go-to is Metro Access, but we also have Call and Ride here in Montgomery County that's partially funded by the federal government. I also recommend a lot of the churches here have transportation of volunteers. So I always have them call their church, or I can call their church and find out if they have a program for them. And as Jackie was saying, the next best thing is usually housing. So right now, we're not having a lot of people telling us that they're having issues with rental, but as we know, as the economy continues to worsen, we're going to start seeing a lot of people with evictions. And I'm already starting to see people saying, well, my landlord is raising my rent. So I refer them over to the Maryland Rental Assistance Program, RAP. They can also call the Department of Human Resources. I have a number that I can give them. So if they do need shelter, they'll find a shelter for them. And besides food, transportation, and housing, the next thing is they tell me, well, I need a therapist, or I'm feeling sad. I just lost a relative. One of the services that we use a lot is grief, loss, and support. And there's a 1-800 number. Of course, we try to connect them to a therapist. As Jackie was saying, that list gets updated all the time because sometimes they don't take any more patients, or we have to find out, do they take Medicare? Do they take Medicaid? And we do work with our Adventist faith-based, we have the outpatient clinics and the inpatient hospitalization. And also, I also give them the SAMHSA, or the SAM, H as in Harry, S as in Sam, A, the mental health substance abuse number. It's open 24 hours, 7 days a week, and it's in English and Spanish. They press 2 for Spanish, and they get a counselor that talks to them about their mental health, also substance abuse. I've referred a couple of my patients there. They have as they like to say now, we don't call it alcohol abuse. We just say alcohol issue, or a problem with alcohol. And I refer them there, and they've talked to a counselor in Spanish. That's been a very big help for me. And then from there, the provider can work with them in working with that helpline and trying to get the patient the proper help.
Thank you.
And that's about it.
Thank you. Thank you so much.
You're welcome.
And, like I mentioned again, calling these places, I think it's, really getting to know what these organizations offer. CHEER is another great program. You just have to know that the limitations that it had. Sometimes these particular programs, they only serve specific zip codes. And again, just making sure you follow up with your patients that you're referring to these programs, just to make sure that, how is the referral process going? Did someone reach out to you? And if someone didn't reach out to you, following back with organization as to what happened, what came lost, and, just really getting that feedback as to, well, are we going to use this again? Was this beneficial? Or, is there a waiting list? Can we refer more patients to this? That's definitely very important in seeing and vetting community resources. So, and again, in our huddles, like we mentioned, our team, they share resources. They say, hey, this place is no longer taking, you should try this place. So just, getting to know your organization and sharing that information with your, with the individuals in your organization is definitely very helpful. Next slide. Yes, and this is something that we just wanted to share because, we've seen a need in our community. And again, we offer free virtual support groups at Adventist, and we changed there's, the classes change monthly, but, these are completely free resources to your patients, to yourselves, to anyone in your community that wants to register. These are guided by a therapist on the call. And so if anyone needs to, if anyone would like to join these, we have the link here. So it's adventisthealthcare.com support groups. And again, this is completely free. This is not based on insurance. If you know anyone that's dealing with grief and loss support, they meet on a weekly basis and at specific times, caregiver burnout, coping with chronic illness. So again, if you know anyone in your community that would benefit from this, I highly encourage, again, completely free. Another one of our most popular ones is, next slide, please. is our mindful eating one. And again, for patients that have prediabetes or diabetes, these are free events, and they, the date changes. We just had our last one, May 18th. And if you log into the page, you'll be able to register for our next session. So again, these are great resources for anyone in our community. And that's all I have for today. Thank you.
Thank you, everyone. So I do have a couple of questions that I'd like to ask. So someone asked about getting the slides, and we do put up these slides as well as the recording following the event. So the first question that I'd like to ask is to, sorry, just one second here. It's for Cheryl and Jordan. Sorry, my apologies. Nana, can you see the question by any chance?
Yes, Melanie, I'm happy to jump in. So we do have a question from Monique Randolph, and this is either for Cheryl or Jackie, if you can provide a response to this. She asked if there are any specific resources or individuals for Baltimore City.
Sorry, I just heard Baltimore.
Oh, let me repeat that question. Can you hear me okay now?
Yes.
So the question is, are there any specific resources or individuals for Baltimore City?
So I can start, and then Jackie, if you want to jump in. So there are lots, I mean, just tons and tons of resources, which is why it can sometimes seem very overwhelming and like, where do you even start? So I guess a follow-up question would be if there's a specific area of need that you're looking for resources. I am not myself terribly familiar with Baltimore City resources, but I would encourage you to maybe start with some of those primary agencies that are going to be in every county, like the Department of Social Services, Bureau of Aging and Disabilities, and the Health Department. Kind of if there's a need that falls under the general areas that they cover as far as resource provision. If they don't provide the specific resource that you're looking for, they would be a good place to be able to direct you, because they're going to have a lot of partnerships with some of the other nonprofits and smaller community resource agencies in the area. Jackie, I don't know if you have anything to specifically.
Yeah, and again, I would highly encourage as well, the sites that we mentioned, 211, you can, specifically put the zip code and exactly what it is that you're looking for. I would start off in there as well.
Thank you so very much, Cheryl and Jackie. A couple of people did add some comments in the chat, so there are some other resources there as well for you, Monique. So we have an additional question, and this is for Cheryl. What's the best way to keep track of information about community resources?
So that's going to be, I think, specific to your program and what your capabilities are. I would start by first utilizing the resources that have already been built. So I think some of the statewide ones like 211 and findhelp.org. There are some community specific ones. I know in Carroll County, we have a community resource directory that has a lot of Carroll County specific resources. So I'd start by finding out what's already out there before you put all the work into creating your own. But there may be reasons that you would want to have your own internal kind of information tracking system. So I know for us, we do keep a specific mental health resource guide that we utilize some of those community-wide guides to build it, but then we keep track of, they take this insurance and currently they have this wait list, and then we share that within our team. So it's got a little bit more up to the moment information that our teammates can benefit from. So sometimes it may be, maybe a spreadsheet that you're keeping updated or a Word document, something that I would encourage you to make shareable, because if you have one person in your practice that is doing all of this and then they're out of the office unexpectedly, you want you want the information to be accessible to whoever is going to be making sure that patient needs are still being met.
Thank you so much for that response, Cheryl. This question is for Jackie. What are the most common behavioral health referrals your team utilizes?
Yes. So we, again, we have, we're part of a big hospital organization. So one of the major ones that we send out to is to our own outpatient wellness clinic. But also we have ones there booked. We have other, JESA is another one that's within our community. Family Services also has another one. Luz, do you have any on the top here that any organizations that we refer for behavioral health? If we have an emergency, you know, and there's, you know, we can't get a psychiatrist, right? You know.
Yeah, I would say the SAMHSA, the SAMHSA, and their number is 1-800-662-4357, and that's the national helpline for mental health and substance abuse.
And also the crisis center is a great place if you can't connect to, you know, you have a patient in high need, they're not you know, they technically, you know, they don't have to go to the emergency department, but, you know, they need evaluation very quick. The crisis center is a perfect place to start off and getting them connected with behavioral health resources.
So I noticed that someone has put an additional resource in here that says that we're looking forward to the 988 hotline that will provide treatment for mental health and substance abuse. It will be one call for all of Maryland starting July 16th. So maybe that's something that we can kind of all add to our repository as well. There's several really good comments in here. I'm just gonna highlight a couple of them. So Robin Holler pointed out that there's an online community resource guide for seniors. Anne Marie Rawa, I'm sorry if I pronounced your name wrong, is saying that the mayor's office is a good place to start. John Crouch, who is the clinical coordinator for behavioral health system for Baltimore, gave his email if you'd like to reach out to him for assistance with behavioral health resources in the city. Someone was asking about personal care services in Howard County. So there is a waiting time for them. So if someone has an answer to that. And then I just mentioned about the 988. Someone put up here too that another good place to find a therapist is on Psychology Today website. So you could filter on different types of providers. That's a good suggestion. And then Luz just put up the information that she gave us verbally about the SAMHSA guidelines. And then I think we have a couple more questions from participants. Nana, do you want to go on to the next question?
Hi, Melanie. I just want to answer the question on the aid for Howard County. So I'm not familiar specifically with Howard County, but I know in Montgomery County there is a very high waiting list. We've gotten waiting lists for like 6 months or greater for patients. But I always try to reach out to faith-based organizations. You know, sometimes they have volunteers that can, do errands for patients. You know, if they, they can even, I've even seen cases where, they really help out, clean the house, or, do those things that, an aide could potentially help with.
And in addition to that, like if you have a patient on a wait list and something has changed with them, like with their ability, and you feel like they've declined, they can always redo an assessment, like a screening on them to see if they score as a higher priority.
That's a great suggestion. Thank you, Jordan. Nana, do you want to move forward with the next question?
Sure, I'm happy to. So this question is for Cheryl and Jordan. What if there are no resources to address the patient's needs? What do you do in that situation?
I think if you're coming up empty and you've reached out to all of your contact people, the in all likelihood, if you're finding that there's a resource gap, other people in your community have found that there's a resource gap as well. So I think that's, again, where that coalition building can be really, really helpful, because one practice or one small group of people trying to create a resource to fill a gap is really, really difficult. But if you can get key people from across the community to say, yes, we're seeing this too, we need to build something that may not be an immediate answer for your particular patient, but it can lead to some structural changes and some improvement in resource availability in the community at large. We also use those contacts at other organizations, really, even to just help brainstorm. If our team is running out of options or we don't have ideas, we'll pull together kind of an informal multi-D with our partners from these other agencies to say, even if it's just speaking in generalities, it's great when we can get the patient consent and really kind of have a true information sharing conversation. But just to say, hey, we've got this need, we can't come up with any resources. Does anybody else have ideas? And we almost always come up with something. And most of the time it's the Bureau of Aging saying, okay, I'm going to look into this. And DSS will say, I'm going to look into this. And the hospital is going to do this. And it's just a great way of getting the team approach to solving some of these issues that are really just terribly complex. Patients are facing a lot of challenges, and it can take a lot of complex answers to try to help them.
I mean, I think that's great advice about building and utilizing the medical neighborhood. Jackie, did you want to add something? I saw you shaking your head. Did you want to add something to this, or would you like for us to go to the next?
No, you can go.
Okay, yeah. So again, utilizing the medical neighborhood and building that medical neighborhood and those relationships and leveraging those relationships is really important to helping the patients. Anena, would you like to ask the next question?
All right, so this question is for Jackie. Jackie, where do you refer Prince George's County patients with food insecurity?
I will let Luz answer that question.
Hi. Well, I start off doing an assessment and see what they have around them. So if they have a church nearby that have a food pantry, I also can refer them to PG County has free food giveaway. And I'll put the number down. It's 301-909-6343. They can call that number and they'll find out what resources are near them. A lot of these places have food already bagged and ready to go. Also, Food and Friends, although the PG County office is not answering, so I have to call the DC office and then they connect me. As I was saying, the senior nutrition program in PG right now hasn't been funded until June, but they're my go-to. Once they're funded, I call them up until probably December, and then they run out of funds again. But they will take care of anybody that's over 60 that has any medical issues or that are homebound. As long as they have a driver's license that says that they live there in PG County, and they get a medical note or anything, a note from a doctor's office or any discharge paperwork that has their medical conditions that qualifies them.
Thank you, Liz.
I'm just going to go through just a couple more items on the chat, and then I'll go back to and then see if we have more questions. Luz mentioned a resource here called the Rental Assistance Program, or RAP, to give people if they need a shelter contact. So that's there. And then there's a couple of responses to some other things. So Anena, did we have, we maybe have time for one more question. Did we have any other questions at this time to go through?
Sure, we do have time for that. So I can, the additional question, and this is for Cheryl, is Cheryl and Jordan, how can you know where to start looking for resources?
I think that's kind of what we've already talked about with kind of identifying in your area what are those key agencies and what are the trends of needs in your office, and kind of starting those relationships from there. And really, once you have those relationships, it makes everything so much easier. And that can be difficult or easy to establish those relationships, but it does definitely pay off in dividends. Jordan, anything you wanted to add to that?
No, I think you covered it.
So I want to give a special thank you to our speakers today for sharing this very valuable information with all of our attendees. There's also some good information in the chat. So we will try to make the slides, the recording, and the information in the chat available to everyone. I want to thank all of our attendees. As I mentioned earlier, our next event is on June 21st, and it will be focused on community resources for long-term care. I know someone mentioned faith-based resources today. They'll be talking about some of those, including parish nurses that can sometimes go into patient homes and help out with different things. So we'll be building on this, taking a little different perspective on it, because it will be more from that long-term care and supporting and supplementing long-term care. And I think that's all I have for you guys today. So thanks, everyone. Thanks very much. And we will be seeing everyone soon. Have a great Memorial Day weekend. Thank you.